I'm Dr. Jean-Marc Voyadzis. I'm a neurosurgeon in the Department of Neurosurgery at MedStar Georgetown University Hospital. I'm also co-director of the Center for Minimally Invasive Spinal Surgery, and I'm director of the Spinal Oncology and Spine Tumor program at MedStar Georgetown. When it comes to conditions of the spinal column, I see a number of patients with degenerative conditions of the spine, as well as a number of patients who have either primary or secondary tumors of the spinal column. The future of spinal surgery is very bright. We're learning to do spinal surgeries in a manner that's so much more efficient and safe than we used to decades ago, and that's harnessing technologies that exist and future technologies to the betterment of patient care. So it involves spinal robotics, it involves spinal navigation, it involves the use of AI that I think will only be beneficial for our patients as we move forward. I think patients should come to MedStar Georgetown because we have a group of physicians who are fellowship trained, who have a wealth of experience, and who are world-class, and who can tackle very complex conditions of both the brain and spinal column. We have phenomenal nurses that we're incredibly proud of. We also have the most state-of-the-art pavilion in the Verstandig Medical Surgical Pavilion that has the most advanced technologies which will allow our patients to recover better and faster than ever before. To be endowed with the ability to have an immediate impact on patients' lives with the surgeries that we perform, be they surgeries of the brain or spinal cord or spinal column, is incredibly gratifying. I treat a number of pathologies of both the brain and spine. The majority of patients that we see with spinal disorders have degenerative conditions of the spine, such as disc herniations, disc degeneration, deformities of the spine, and so we treat a number of conditions that are degenerative in nature. We also treat a number of tumors of the spinal column, be they primary tumors or secondary tumors of the spine. The field of robotic spine surgery has really taken off over the course of the past 5 to 10 years, and our Department of Neurosurgery here at Georgetown has built a robust experience in robotic spinal surgery. We're one of the leaders in the East Coast in terms of sheer number of robotic spinal surgeries that we perform, particularly as it relates to minimally invasive spinal surgeries, which is a particular interest of mine. Patients who are candidates for robotic spinal surgery are patients who need to undergo a spinal fusion intervention, which involves placing implants in the spinal column. And so robotic spinal surgery allows us to place those implants with a high degree of precision, sometimes allowing us to make much smaller incisions while improving patient outcomes and reducing the amount of radiation exposure that a patient needs to undergo in the operating room, and also reducing the amount of radiation exposure to the operating room staff, from the surgeons to the assistants to the technicians. Spine tumors are either primary tumors, that is to say that they originate from the spinal column itself, the bony elements, the cartilaginous elements, or the soft tissues, or they can be tumors that originate from the neural elements, from the spinal cord or the nerves, which is something that comes to our attention frequently as neurosurgeons. And when these tumors develop and involve the spinal column, by distorting normal anatomical structures, they can produce pain. So pain is one of the most common manifestations, potentially, of a spinal tumor. As they continue to grow and they can encroach upon neighboring areas, specifically the spinal cord or the nerve roots that emanate from the spinal cord, they can start to produce neurological symptoms, such as tingling or numbness or weakness in the extremities. If the tumor is severely involving or impinging upon the spinal cord or the nerve roots, patients can develop profound weakness and difficulty with ambulation or a sense of imbalance. So if any of these conditions arise, it's typically best to consider seeing a physician and undergoing imaging studies to make a diagnosis. It's a really exciting time to be a neurosurgeon and to be able to treat disorders of both the brain and spinal column, or tumors of the spinal column or the spinal cord. Here at MedStar Georgetown, we're actually innovating in robotics and minimally invasive technologies. We have a very robust center of minimally invasive spinal surgeries, which allow us to perform an operation such as a removal of a tumor or a decompression of a nerve or a spinal cord through very small incisions. With the advent of robotics and spinal navigation, we can use robotic arms to help guide the placement of implants through very small incisions. And we, along with other groups across the country, have demonstrated that these less invasive surgeries allow patients to recover faster. There are lower associated complications such as infection or blood loss. They have less postoperative pain. They can return to their natural life in a much faster manner. And overall, we've shown that it can significantly improve outcomes compared to more traditional treatments. So we're innovating in all these branches. We're also very excited about the advent of artificial intelligence. We're currently using AI to help rapidly diagnose conditions of the brain and spinal cord with our neuroradiologist. We're going to be increasingly incorporating AI in the preoperative planning of surgical interventions. We can use AI to create 3D reconstructions of a patient's spinal anatomy or a patient's brain anatomy in order to prepare us better for an operative intervention. We can use AI with robotics in the operating room, and we're also incorporating predictive analytics to allow us to determine which patients are best candidates for surgery to ensure the best outcomes, be they patients who have degenerative conditions of the spine or even more serious tumors of the spinal column. We're very proud of the new medical surgical pavilion at MedStar Georgetown. The freestanding pavilion is a state-of-the-art facility. It's the most advanced facility in the area, and we have the most advanced technologies in the area. We have state-of-the-art microscopes. We have an intraoperative MRI that we can use for brain and spinal pathology. So we're very excited about the pavilion. I think it's the best in the region. If we divide diseases that affect the spinal column in terms of degenerative conditions of the spinal column, that is to say, when discs start to wear out, when the spinal column becomes abnormal in its curvature and alignment, when patients develop a narrowing of the spinal canal that we call lumbar stenosis, those are usually degenerative conditions that develop over time. So the older one patient gets, the more likely a patient can develop degenerative conditions of the spine. When it comes to the treatment of tumors of the spinal column or the spinal cord, which could be primary or secondary tumors, they can unfortunately affect patients of all ages. Most complaints of pain related to the spine, whether it's neck pain or thoracic pain, which is the middle portion of the spinal column, or low back pain, are usually treated conservatively. They're usually the result of what we call a lumbar strain or a lumbar sprain or a cervical strain or sprain, which is typically an inflammation of the supporting soft tissues of the spinal column. They usually get better with a period of rest, anti-inflammatory medications, perhaps a muscle relaxant, and patients recover fully. When patients have persistent pain that goes on for a longer period of time, despite those treatment modalities, or if they start to develop neurological symptoms that we talked about, such as pain that radiates into an extremity, tingling, numbness, weakness, trouble with balance or walking, then that's when we start to become concerned that there is a more serious problem that could be affecting the neural elements. And in those circumstances, you want to bring that to the attention of your primary care doctor or a specialist such as ourselves, where we can order diagnostic imaging. So we usually consider surgical intervention for degenerative conditions of the spine when all other treatment modalities have not provided long-term relief. Oftentimes, as I mentioned, a period of rest can improve symptoms. Modification of certain activities can improve symptoms. Physical therapy to strengthen the core is a very important treatment modality that can help in many circumstances. When those treatments fail, we sometimes consider pain management strategies consisting of injections in the spinal column to help relieve pain. When those treatments fail, that's when we start to consider surgical intervention. So pain that is severe and daily, that has been refractory or that has not been able to get treated with conservative treatment measures, and when imaging studies show a structural problem, that's when we start to consider surgical intervention. The treatment of patients with spinal tumors is collaborative in nature, and so we work very closely with a number of our colleagues. We work with the medical oncologist, who are part of the MedStar Georgetown Cancer Institute and the Lombardi Cancer Center here at MedStar Georgetown. We work very closely with radiation oncologists who have a very robust program in the delivery of radiation to our patients with spinal tumors. We have 2 CyberKnife radiosurgery devices here at Georgetown, and we also have a proton beam radiation center, which was the first in the region. These technologies allow us to deliver pinpoint radiation while avoiding a lot of damage to neighboring healthy structures. So we work collaboratively with our radiation oncology colleagues, or we work very closely with our neuroradiologists who help us with the diagnosis of certain conditions of the spinal column by very carefully reviewing imaging studies. And of course, we work very closely with our neuropathologists here at Georgetown who are dedicated to the microscopic analysis and diagnosis of tumor specimens. So we have a very robust collaborative approach. We hold multidisciplinary meetings almost weekly now where we review cases, we reach a consensus in terms of treatment, whether it's surgical intervention, medical therapy, or sometimes conservative treatment, or radiation treatment, or adjuvant therapy where we perform surgery first and consider the additional treatments later. Well, I think we're very excited about our robotic spinal surgery program here at MedStar Georgetown. We launched this about 4 to 5 years ago, and we really transformed it into the most robust spinal robotic surgery program in the region. We've published on a number of occasions looking at the use of minimally invasive techniques with robotic spinal surgery, demonstrating that robotic spinal surgery is very accurate, also demonstrating that we're improving outcomes by improving accuracy of implant placement and also reducing the types of incisions that we need to make, improving recovery, and facilitating patients to return to their daily lives.